News Health Alert. With the flu spreading fast, 2 News is working to keep you and your family healthy. We're bringing you special reports tonight on what we're calling Flu Fighter Friday. We also have local doctors and nurses on hand right now answering your questions. They'll be here until 6:30 tonight. The number 918-748-1432. 2 News anchor Stephen Romo is in our phone bank right now. And Stephen, how's it going there?
It's going really well. It's definitely picking up. You can hear the phones ringing in the background as we have these health professionals here answering your health questions. Obviously, the flu is causing a lot of concern lately. Those numbers are on the rise, and a lot of concern answered best by the professionals here. We have Dr. Roland here. He is from St. Francis, and he's been taking some calls here. So can you tell us, Dr. Roland, what kind of calls have you been getting so far?
Well, we've been getting a lot of calls about the influenza vaccination. Is it still okay to take it? And the answer is yes. Where you can get it, and the answer is you can get it at most drugstores still. And then there's been some personal questions about whether this or that person has the flu.
Right, a lot of confusion about what the symptoms are. Is that some of the questions you're fielding right now?
Absolutely, and in the middle of an epidemic like we are now, almost anybody who has respiratory illness, such as even a sore throat, along with a fever, or maybe even without a fever, we think they probably have influenza in this stuff, so you need to be looked into.
I got you. You can hear the phones ringing off the hook. We're going to let you go back to answering those questions, Dr. Roland. You can hear the phones ringing now. A lot of people have they're very curious about if they have the flu and if it's too late to take that vaccine. We'll be here until 6:30 answering your questions. One more time, that number, 918-748-1432. You still have time to get your questions in. Reporting live, Stephen Romo, 2 News works for you.
Thank you, Stephen. Now, this week's death of a child underscores just how vulnerable children can be to the flu virus. 2 News reporter Patricia Santos continues our team coverage with symptoms that parents need to watch for.
Look for signs of a high fever, irritability, or even a mild cough. The key here is to follow your parental instincts.
You know your kid better than any physician, so if you think your child looks really ill, if they're not eating at all, if they're not very responsive.
If they're having trouble breathing, this could be a sign of a more serious case. Babies and toddlers and those with a weak immune system are going to be more vulnerable to getting sick as those who are in daycare or in school. If your child hasn't gotten the flu shot, it's not too late to do so.
You're looking at children under the age of 2 are really considered higher risk, and any children with another type of health problem. So, and that's the main thing that makes someone more critical, is if you have a risk factor that puts you more likely to get one of the serious complications such as pneumonia.
Remember to teach your child to cover their mouth when they cough and also to keep their hands away from their mouth. Patricia Santos, 2 News works for you.
Thanks, Patty. Now, seniors are also at high risk for the flu. Because the immune system weakens as we age, adults 65 and older are much more prone to catching the virus. Doctors are now recommending a high-dose vaccine. The higher dose is designed to be more effective and gives better protection against influenza.
At 65 is the time when we start seeing the response to the vaccine begin to go down. And so it becomes more effective as we get a higher dose of the vaccine because the person's immune system responds better to a higher dose of the vaccine.
Older adults often have chronic health problems such as diabetes, high blood pressure, and heart disease, and they just can't handle the virus too. The other conditions can make the flu dangerous and potentially deadly. Up to 40,000 Americans die from the flu each year, so it is serious. Going in depth now, more people have died from the flu here in Tulsa County than any other county in Oklahoma. Take a look at the numbers. We're going to put them on the screen for you. 3 people died between September 29th and January 14th. 104 people have been hospitalized just in Tulsa County. Compare that to the Oklahoma City area, Oklahoma County's next highest county. Only 60 people hospitalized. No deaths there. Deaths also reported in Okmulgee, Osage, Pittsburgh, and LaFleur counties, so green country hit very hard. Now, convincing people to get a flu shot each year is the first weapon in the war on flu. Area hospitals depend on it to protect their own home front. Hillcrest Healthcare System required every one of its staff members to get the vaccine. Vendors even required to roll up their sleeves. New tonight at 6, I'll show you how this strategy is helping protect patients and even the community at large. Our flu coverage continues on our mobile app and on our website, kjrh.com.